All right, let's talk about a denial code that I'm sure every single medical biller has seen, the dreaded CO-18, the duplicate claim. It's one of those common headaches that can really slow things down. But here's the good news, it's almost always fixable. So let's break down exactly how to do it. So are you seeing double on your remittance advice? When that CO-18 pops up, it means the payer is pretty sure you've sent them the exact same bill more than once. But here's the thing, is it really just a simple mistake, or is there maybe a little more to the story? Let's find out. Here's what we're going to cover. First, we'll decode what CO-18 really means. Then we'll get into the two main reasons you see it. After that, I'll give you a quick investigation checklist. We'll figure out which modifier is the right one to use. And finally, we'll map out the different ways you can resolve these claims and get them closed out. Okay, first things first. Before you can solve any denial, you have to know exactly what you're up against. So let's define what actually triggers a CO-18. So here's the official word. A payer's system flags a claim when it looks identical to one they've already got in their system, especially for the same patient, same service, same day. But the most important part of this whole definition is that last phrase, without proper justification. That's the key, and that's exactly what we're going to learn how to provide. And hey, if you feel like you see this one a lot, you are definitely not alone. The duplicate denial is a classic. It's on just about every denial management cheat sheet out there. The fact that it's so common means there's a really well-established process for getting it fixed. So when you get a CO-18 denial, your very first job is to figure out which of two very different situations you're dealing with. Was it just a simple billing error, or was it a totally legitimate repeat service that just needs a little more explanation? It pretty much boils down to one of these two things. Because number one is just a simple accident. Someone clicked submit twice, or maybe there was a system glitch. It happens. But cause number two, that's a legitimate repeat service. This isn't an error at all. It just means the provider intentionally did the same procedure twice for a good reason, and now we just need to use the right code to tell the insurance company why. So how do you figure out which one you're dealing with? Well, you have to do a little bit of detective work. Let's walk through the action plan. These are the first steps you need to take to get to the bottom of that denial. This 3-step check is your starting point every single time. First, just check your own billing system. Do you actually see two identical submissions? Easy enough. Second, go look at the patient's charges and the clinical notes. Was this service really performed twice? And third, hunt down that original claim. What happened to it? Is it paid? Is it denied for another reason? Or is it still pending? The answers you find here are going to tell you exactly what to do next. Okay, so let's say your investigation shows that, yes, the service was genuinely performed twice. This is where modifiers become your best friend. They are literally the tool you use to communicate the why to the payer. Now, you've got two main options here, but choosing the wrong one can just lead you right back to another denial. So the big question is, do you need modifier 76 or do you need modifier 77? And believe it or not, the difference is super simple. It all comes down to one single question. Who performed the repeat service? If it was the same physician who did it the first time, you're going to use modifier 76. If it was a different physician, you're going to use modifier 77. That's it. So let's lock this in. Modifier 76 is for a repeat procedure by this same doctor on the same day. Just think of it like this. The doctor had a valid medical reason to do the exact same thing all over again. And you guessed it, modifier 77 is basically the same scenario, but this time a different doctor comes in to perform the repeat service. This is your signal to the payer that two separate providers were involved on that day. Now here's a little pro tip for you. What happens if you do everything right? Use the correct modifier, you send it in, and the claim still gets denied as a duplicate. Don't give up. This is your signal to actually pick up the phone, call the insurance carrier, and ask them to have a human look at it. Sometimes their automated systems just get stuck in a loop. Okay, so we've identified the problem, we've investigated the cause, and we've picked our tool. Now, let's bring it all home and look at the 3 final paths you can take to get this claim resolved and off your list for good. Think of this as your decision tree. Path 1, if you confirmed it was a legitimate repeat service that just needed a modifier, you append the right one, 76 or 77, and resubmit. Path 2, if you found the claim was actually billed correctly from the get-go, you call the insurer and ask them to reprocess it. And finally, Path 3, if it was a true accidental duplicate and that original claim is already paid, the right move is to simply write off the duplicate charge. Done. And that is really how you conquer the CO-18 denial. See, It's not about luck. It's just about having a methodical process of investigating and taking the right action. So I'll leave you with this question to think about. How can you maybe tweak your own workflow to catch these potential issues before the claim even goes out the door? Thanks for tuning in.